Obviously, after this morning's press conference, I did foreshadow that the situation was evolving, that the Cabinet Crisis Committee of the New South Wales Government would take the advice, the health advice that was provided to us later that morning or this morning. And I will say this, that the New South Wales Government has always prided itself on taking the expert health advice. We're never afraid to take a decision we need to keep our citizens safe. And even though we don't want to impose burdens unless we absolutely have to, unfortunately, this is a situation where we absolutely have to. A few days ago, I said this was the scariest time that I felt since the pandemic started, and that's proven to be the case. So from 6 p.m. today, all of Greater Sydney, the Blue Mountains, the Central Coast and Wollongong will go into a lockdown with stay-at-home orders in place until midnight, Friday the 9th of July. So essentially, a fortnight from midnight yesterday, all of Greater Sydney, the Blue Mountains, Central Coast and Wollongong will go into lockdown with stay-at-home provisions. What does that mean? It means all of us have to stay home unless for the four following reasons. Unless we have to work outside the home or get educated outside the home, and given school holidays, that obviously doesn't apply. But if you must work outside the home, you're able to do that. If you need to seek medical attention, including getting a COVID test, getting a vaccine or any other medical attention, you're allowed to. And you're also allowed to leave the home for care and compassionate grounds as well. And obviously, you're allowed outside to purchase goods, essential goods and services. And I know I'll say this, and I please appreciate people following these instructions. There is no need to panic buy. All the shops will be open every day of the week. There is no curfew. You can leave your home at any stage to purchase any essential goods that you need to, and that is a given. So please be thoughtful and considerate about fellow citizens, and no need to panic buy. For the next 2 weeks, you will be able to exercise outdoors, and we appreciate during the school holidays this could be the only time that people are able to gather outside, and in no more than groups of 10. So in the regions that we've outlined, in no more than groups of 10, you're able to gather outside for that recreational exercise. And of course, when you are outdoors in groups of 10, make sure you maintain a good social distance and follow the health instructions. Weddings are able to proceed tomorrow. Obviously, today and tomorrow, it's both lacks compassion and also not fair to cancel weddings. So today and tomorrow, COVID-safe weddings will be able to take place. But unfortunately, from Monday, for the duration of the lockdown, weddings can't take place. Funerals can take place with a maximum of 100, 1 per square 4 metre, masks indoors. Can I also stress that during this time, even when you're going out to buy food or going about your business or essential work, that every time you enter a business or any premise that you use the QR codes. As you know, the New South Wales Government is mandating for QR codes to be everywhere at all times. So make sure, no matter whether it's a temporary purchase, if you're going into a supermarket or you're going to grab a takeaway, that you do log into your QR codes, and that's really important. I also want to foreshadow that nobody should feel stressed about their financial situation. Obviously, there are provisions for us, and we will, as a state government, in the next few days, we'll be announcing support to businesses, and also the federal government support to household kicks in at a certain time, and obviously that will kick in. So nobody should feel stressed or pressure to break any of the rules because of their financial situation. The New South Wales Government will be there to support businesses, and of course the Commonwealth support to households kicks in as well, and we will provide that information and that detail in the next few days. But in the meantime, I don't want anyone to feel stressed more than we need to, and I don't want anyone to feel panicked about their financial situation. Now, what happens in the rest of New South Wales? Well, regional New South Wales, so the areas that I haven't spoken about, which aren't in lockdown, will have to undergo restrictions that have been in place for broader Sydney. So in the regions, no more than 5 visitors in your home. All hospitality has to be seated, 1 per 4 square metre rule. Only a 50% capacity for outdoor events, indoor mask wearing, and again, restrictions in relation to funerals and weddings. So for those parts of New South Wales that aren't in lockdown, restrictions still apply, because we want to make sure that if there have been any occasions where people unknowingly have taken the virus outside into the regions, that we don't have any spread in those regions. Now, Dr. Chan has often said that when you have a contagious variant like the Delta virus, a 3-day lockdown doesn't work. If we're going to do this, we need to do it properly. There's no point doing a 3-day lockdown and then having the virus continue to bubble away in the community. Now, if after 7 days there's a dramatic change in the trend, well, obviously we'll evaluate the situation. But at this stage, the best health advice we have is that a 2-week period, or until midnight the Friday the 9th of July, is necessary in order to make sure we get to our target of zero community transmission, which has always been our target from the beginning of the pandemic. Given how transmissible the virus is, given the extra exposure venues, we know that even the best contact tracers in the world can't stay a step ahead unless we put this in, and we need to do it properly. So there was no point doing it for 3 days or 5 days because it wouldn't have done the job. The best health advice today is that it should be for 2 weeks, but if there is any massive improvement ahead of that time, of course we'll evaluate that. But the best advice we have from Dr. Chan and the health experts is that we should brace ourselves for more cases. We're finding that all household contacts, unfortunately, are getting the virus. Transmissibility is at least double what previous variants have been. So we do need to brace ourselves for potentially larger number of cases in the following days, and that's why it's so important we take action now. We always take the best health advice in New South Wales, and this is the best advice we have. And please know that we'll get through this. It's never easy when all of us have to face these circumstances, but we're all in the same situation. We've had to do this before. We know the drill. And I'm just asking everybody not to cut corners, because if just a handful of people cut corners, all of us end up in a very difficult situation. I just want to thank everybody for your patience. I want to thank you for trusting the government. We trust our people. We trust our people to do the right thing. And we hope that at the end of the 14-day period, or July the 9th, we all look back and can feel proud of the way in which we all came together and responded. I'll now ask Dr. Chan to reinforce the messages she wants all of us to hear as our Chief Medical Officer. And I do want to thank her and the team. Our contact tracers have been amazing. But when you uncover just one case that's been to a number of venues for a couple of days, that is a huge risk under these circumstances, and that's why we're taking the action we are. And after Dr. Chan reinforces the messages, Minister Hazzard will say a few words. And obviously, I'll just make this point as well. If you are from regional New South Wales currently in those areas that are being locked down, you have to sensibly make way back to your homes, but you have to keep yourself isolated for 14 days. And I'll ask Dr. Chan to repeat that message to make sure that if anybody unintentionally has the virus and goes back home, that they self-isolate for 14 days to make sure that it doesn't get out into the community. And after Dr. Chan gives her update, Minister Hazzard will say a few words, and then we'll take a few questions. Thank you.